Jessica Hatch here with Infinity Centers United. We're very excited about our partnership with Regenerative Center of Texas, and so I'm here to introduce their team, as well as go into detail of what regenerative medicine exactly is. We've got Dr. Barta Tencio, and we got Dr. Michael Fushansky, and Tatiana, who is also part of their team. Regenerative Center of Texas, that name, can be very broad. So Dr. Fushansky, if you can kind of just start on, bringing us up to speed with what that means.
I think Regenerative Center of Texas, the word regenerative really summarizes our approach to treatment, to treating patients. Our approach consists of using stem cell therapy in addition to doing physical medicine rehabilitation at the same time. To give you an example, patients coming in with low back pain, on MRI we determine that they have a disc problem. So our approach will not consist only of injecting stem cells into the disc to repair it, but also restore a normal biomechanic of the spine, and patient will go through progressive treatments which are administered by Dr. Atencio, that done in conjunction with stem cell therapy.
Okay.
So I think the word regenerative is exactly what represents our approach.
Mm-hmm.
So regenerative is not only the stem cells, it's not only PRP or other things that grow and regenerate the tissue, but regenerative means physical medicine that allows us to return the joint and the spine to its normal condition.
And I think it's unique. So you're a chiropractor and you're an interventional pain specialist, and I think the combination is it's so smart. I mean, with the combination of what you can do, combined with some of the laser treatments, the DRX machine. So tell us a little bit about that aspect.
Yeah, we have certainly a very unique approach that's taken years to really refine. 7 years ago when we started this, people were injecting certain types of tissues, they was in stem cells or PRP. Over the years, we've really refined what works in each condition. So now our treatment of spinal conditions, our treatment of joints, our treatment of skin and our hair, we've refined to certain specific protocols that we know work. The combination is because when you look at regenerating a structure, if you take a spine, for example, if you put in cells, but then combine that with decompression, which will open up that disc space, or if we can get the most out of our PRP injections, which we'll talk more about, it really is the combination. So some people are maybe just injecting and hoping for the best, where we really know what works, and it really is the use of stimulation like from a laser, or decompression to prepare the spine before Dr. Fushansky puts in the stem cells. We've just seen such amazing success over the years with this.
Yeah, so in what all areas can this exactly treat? I mean, is it something that's just for the joints, or does it go further than that?
Absolutely. We treat various spine conditions. We treat discogenic pain. We treat degenerative spine disease, degenerative disc disease, and I think we really excel at that. And kind of the unique component of this, as Dr. Tencio mentioned, is our whole philosophy of regenerative medicine. So in order to restore the spine, any singular stem cell or any kind of treatment, you can't convince me it's going to work. You need to prepare the spine through a series of manual therapy, decompression, and then implant the stem cells. We never do a singular procedure for the disc. It's usually 3 procedures minimum in order to regenerate the tissue. Again, this is something that's unique to our practice. We have particular success with knee joint, and due to the nature of the joint itself and the problem that afflicts it, we find that the knee joint really regenerates extremely well. So we have very good successes. Spine, we have a lot of successes. It's more complex because the nature of the pain could be emanating from deeper and different structures. But overall, our approach is very satisfying to me as a clinician who has been treating patients for many years as interventional pain management doctor, and now I truly find the therapies and the combination approach that we develop that I feel that I fully, to a greater benefit of the patient, restore their function and restore the health of their spine, whether it's disc or a facet joint or other structures.
It seems to be more of a long-term, benefit versus a quick fix that some of the, steroid medications can do and last maybe throughout 6 months to a year. But these are things are actually, regenerating certain bones or tissue. Is that kind of a better way of explaining it from kind of an outside,
absolutely,
non-physician?
But in addition, it's interesting you mentioned steroid injections. So steroid injections commonly used now in medicine. They certainly I mean, we have to look at medicine in retrospect in its history. So they serve their purpose. People suffer from sciatica, forever, as long as the humanity existed. But what treatments were available? Quite minimal. So epidural steroid injections really brought that level of minimally invasive procedure that could alleviate pain. However, steroids carry a whole host of problems with them, especially multiple steroid injections could cause issues such as osteoporosis, could further exacerbate your disease. In fact, the recent study showed that injecting steroid into the muscle actually thins the muscle and predisposes it to, let's say, a rupturing. Same thing happens with the disc. So although they have short-term benefit, long-term results of steroids are not that great. But stem cells, in addition to regenerating tissue, also have very potent anti-inflammatory effect. So they could be used at those initial stages. Or when you would use steroid injections, you could actually use regenerative medicine to replace steroids and produce anti-inflammatory and analgesic effects similar to steroids without the side effects, with the further expectation that the tissue will recover and regenerate.
I see. So I guess from the chiropractic side, a lot of the patients that you've treated over the years, I guess prior to being involved with regenerative medicine and the stem cell approach, I mean, what did that look like for you? Was it kind of handing them off to interventional pain or orthopedic and finding that they'd end up doing surgery and then they've got this, long-term, plan of recovery versus, actually not even having to go under, the knife and be cut open and have, to me that takes a lot longer to recover versus these injections that you guys are doing. From the chiropractic standpoint, like before you were involved with regenerative medicine and stem cell approach, I'm assuming a lot of your patient referrals you'd end up in the hands of surgeons, orthopedic or spine, trying to fix a problem surgically. But this is kind of giving an alternative option, in some cases, right?
So my practice, we did see chronic pain patients as our primary patient. These patients would come in with disc herniations. They had tried the steroids. So most of these had gone through physical therapy. They tried the steroids. Because we were a decompression laser clinic, they would come here and we would absolutely improve their case. But the issue was because we couldn't regenerate it, we had to manage their case consistently to keep them functional. So, when I realized this and I learned about regenerative medicine years ago, I sought out a specialist, Dr. Pisansky, and that's where everything changed. Now, not only did we help keep them functional, but we're actually able to repair some of the tissue. So what would often happen is the patient would say, well, okay, I got some degree of improvement with that physical medicine, but I'm not good enough. So then they'd go get surgery, and sometimes they'd be happy for a couple of years, and I'd see them again. The surgery was not always a long-term fix either. The surgery actually can weaken some of the structure. Often we would see another herniation, or what they call recurrent herniation if it was a microdiscectomy, and then we would have to manage that patient more. The regenerative aspect just allowed really true stability, really true regeneration, and we wouldn't have to manage this patient consistently or as much.
And I want to just kind of touch on things, Tatiana. So I guess you've worked with Dr. Pisansky throughout specifically, the steroid injections, like when it was no stem cells were being utilized within the practice. And I feel like there's a different sense of feelings with the patients. It's like they're more excited because it's something new, innovative. It's, it's not the traditional steroids. Do you feel with your patients it's a more exciting conversation about how you're going to help them?
Oh yeah, absolutely. So first of all, they're excited before procedure because we have no negative effects. We have just positive effects. So they're already excited about that. And after procedure, they're coming back and saying, thank you guys. Yeah. So it's like the most excited part of our practice.
Very rewarding.
Yes.
Yeah. We have happy patients, that have chronic
really
pain.
happy patients,
Yeah.
It's really like, it makes your life full.
Yes.
And feel better from some of the ways that things weren't able to.
Yeah, I remember our pain management patients. They're never happy, unfortunately. So regenerative patients, they're happy.
Wonderful.
Yeah.
That's awesome.
Yeah.
Well, thank you guys. I know we're going to go into more detail in a later episode where we can actually talk specific, things that you're doing with the stem cells, whether it be, hair regeneration, MSK procedures, spine. So I want to really get into detail in those later episodes. But thank y'all so much for joining.
Thank you.
I'm really excited about the partnership, and we'll talk to y'all soon.
Great to be here. Thank you for having us.